Hello. Have you been recently diagnosed with fibromyalgia and you're trying to kind of make heads and tails of the situation? Or do you know someone important to you who has it? In this video, we're going to dive into what fibromyalgia is, how it's diagnosed, current medical treatments, and what really works. My name is Dr. Zhang, and I am a chronic pain coach. In my line of work, I hear a lot of misconceptions about what fibromyalgia is, or fibro for short, from what my clients tell me, from what I hear just in the general public, from what I see on the internet. For instance, some people claim that it's just an immune response or an autoimmune issue. Some people say it's a hormonal imbalance. Some people say that because fibromyalgia was traditionally diagnosed by a series of tender points, that it must be a muscle or connective tissue disorder. And some people even say, hey, it's all in your head. And there are even some people who say fibromyalgia doesn't really exist, it's not really a thing. So what is fibromyalgia exactly, and what causes it? The answer is, surprise, surprise, D, it's all of the above. According to the CDC, the official definition of fibromyalgia is a condition that causes pain all over the body, also referred to as widespread pain, causes sleep problems, fatigue, and often emotional and mental distress. People with fibromyalgia may be more sensitive to pain than people without fibromyalgia. This is called abnormal pain perception processing. So what does this mean? Basically, a fibro is just another type of chronic pain. If you refer back to the What is Pain video that I'll link here, fibromyalgia basically is the poster child of biopsychosocial contributions. If you look even just at the definition, there are the physical contributions, such as that widespread pain, but also there are psychological and social contributions as well, including things like emotional and mental distress, sleep problems, fatigue, and also that abnormal pain perception processing. So what does this mean to you? If it is just this biopsychosocial problem, how do you test for fibro? Is there actually even a test for it? Well, yes, there is. Right now, there is a blood test specifically called FMA. It is a cytokine assay, and cytokines are a specific immune marker. Basically, this test tests the presence of immune activity in your body and kind of the amount of inflammation you have. However, just remember, even though this test is a test of your immune system, it does not mean that fibro is only an immune system disorder. It just means that there are immune system contributions to fibromyalgia. So if you have a positive FMA test, what does this mean? What this test can tell you is if you have fibro versus another autoimmune problem, such as rheumatoid arthritis or systemic lupus, if you're healthy. What this test can't tell you is that if you have other autoimmune issues like lupus or rheumatoid arthritis, you can actually have a pretty high positive rate. And the reason why is because lupus and RA and other autoimmune diseases actually have very similar cytokine profiles. So when you have fibromyalgia and you're looking for basically just to see if your immune system is ramped up, if you have other autoimmune things, your immune system is going to be ramped up. So basically, if you already have autoimmune issues, this just kind of muddies the water. The last thing to think about is just because you have a positive FMA test for fibro, that doesn't mean that you don't have other autoimmune disorders like rheumatoid arthritis or lupus. It's not an or situation here, but it can be very much an and or situation. Basically, the FMA test tells you, hey, your immune system is kind of ramped up, and it's ramped up in this very specific way that we see a lot in people suffering with fibromyalgia. But we also see this quite a bit with people suffering from other autoimmune diseases, such as rheumatoid arthritis or lupus. So are there any other ways to see if you have fibromyalgia? Well, there is a clinical criteria. Basically, it's just a list of criteria that a lot of people with fibromyalgia have been shown to have. So this criteria comes from the College of Rheumatology, and this was published in 2016. This general criteria is basically, number one, generalized pain, defined as pain in at least 4 out of 5 regions. 2, the symptoms have been present at a similar level for at least 3 months. Basically just a chronic issue. And number 3, it's kind of funky here. Basically, your widespread pain index score has to be greater than or equal to 7 out of 10, and your symptom severity score is greater than or equal to 5. Or your widespread pain index is 4 to 6 with a symptom severity score of greater than or equal to 9. I know that's kind of funky. But again, these are just trends or groups of things that they've seen in the population that have been diagnosed with fibromyalgia. And number 4, it's not really a criteria, but it's just kind of like a disclaimer. A diagnosis of fibromyalgia is valid irrespective of other diagnoses. So it basically, because you have fibromyalgia, doesn't mean that you don't have other diagnoses as well. And I think that's really, really important to know. So if you look at these criteria and you look at these symptoms, again, they're not super specific. In fact, most people with chronic pain can probably look at this list and check off most of the criteria. So what does this diagnosis of fibromyalgia really mean? And how do we treat it? So in all practical purposes, the diagnosis of fibro helps your healthcare practitioner communicate to insurance companies that, hey, this is the reason why we're prescribing this. This is the reason why we're going down this road of treatment for this person, because people with fibromyalgia have been shown to do well with this group of medication, referring out to psychology, referring out to physical therapy, massage, whatever type of treatments that your provider offers. Another reason why a diagnosis of fibromyalgia is important is that it helps the healthcare practitioner have a general guideline of treatments for you. Not every practitioner out there, especially people like your primary care doctor, is very well versed in the chronic pain realm. In fact, most people are not. So having a guideline, at least something that they feel like they can do for you, is important to at least help get you started down the right path. The first thing that most practitioners do offer, though, are medications. And these medications are typically things like antidepressants, muscle relaxants, even anti-seizure medications that have actually been shown to really do well with chronic pain symptoms. However, as you may know, all of these medications kind of have their own host of side effects, and they really help with just your symptoms versus addressing the real underlying issues, such as your hyperactive nervous system, if you do have a hormone imbalance, having difficulty sleeping. These medications don't address the real cause. Other treatments that you may have heard of or even done yourself are non-pharmacological treatments such as physical therapy, psychotherapy, chiropractic, massage therapy, acupuncture, things like that. These are all fantastic non-pharmacological choices. And as a physical therapist turned coach, I do know that this approach works for a lot of people. However, the challenge is that some of these mainstream treatments, especially coupled with medication and going to see, 5 to 10 different providers in any given week, it's difficult for you. And it's also very difficult when your different providers don't really talk to each other because you're going across town to your psychotherapist, you're then going to PT and then chiropractor on your off days. It gets to be a real hassle, and it's really difficult for everybody to coordinate their care. So what ends up happening is that you're hearing from the therapist that this is causing your pain. You're hearing from the PT that because you're not moving well enough, this is causing your pain. You're hearing from the chiropractor that your joints are not moving well or subluxed or something, and that's causing you pain. And what ends up happening is that you get a whole lot of different voices telling you a whole lot of different things, making you honestly more and more confused, which actually doesn't help your pain state. Another thing that happens is when you go see different specialists, whether it's another psychotherapist, whether it's a rheumatologist, different doctors and different healthcare practitioners, each practitioner sees you in the lens of what they specialize in. And that's fantastic. But again, with fibromyalgia, because it's not just one thing, but rather your whole life that's affecting your fibro, it can be really challenging to get a really good answer when you're going to all of the different people. I've been guilty of this as well in my early PT days before I knew anything about chronic pain. I just wanted to get people to move because in school, that's what we were taught. We were taught that movement is what will make you feel better. Well, the problem is when I started forcing people to exercise, and there was just so much fear that was unaddressed, and there was so much reluctance and just going into the unknown, what would happen is when you exercise, your pain would actually get worse. Does that sound familiar to you? And it's not the exercise that actually made the pain worse. It's just that I never primed people correctly and educated them correctly to say, hey, you're in a safe space. Exercise is okay to do, and this is why, and addressing some of the other issues. But back then, I didn't know any of that. And after treating so many people with chronic pain the wrong way, I figured out, man, there just has to be a better way. And there is. When I started taking a deeper dive into my patients' lives, things like asking them how they lived, why they wanted to do those things, what really, really mattered to them, my patients suddenly seemed more motivated, and man, they were making better progress without even exercising. However, as a PT working in a clinic, it was really difficult under the mainstream medical model to be able to address the things that were important to my patients to the fullest extent so that they could benefit from everything. However, as a chronic pain coach, I can. As we've talked about, pain is a biopsychosocial problem. And fibromyalgia is just the poster child for that. What really works to help you with your fibro symptoms and really getting you on to your path to a pain-free life is to address all of these factors, biological, the psychological, and the social factors that are contributing to your pain. Yes, we need to get you moving and exercising, but in a way that resonates with you. We need to talk about ways to help you deal with your fears around your pain, fears around certain activities, and sometimes even around getting better. We need to make sure that you understand what pain is and what it means when you're experiencing pain. We need to talk about the social aspect of your pain, including how to navigate relationships with your family and friends. When we talk about the cure for chronic pain and things like fibromyalgia, I truly believe that there already is a cure. It's just not in pill form. And it's not easy, but it is 100% achievable for everyone. Thanks a lot for listening. I hope that this was beneficial for you. And if it was, please hit the subscribe button below, and we'll see you next time. Bye.